While there is statistical evidence that black minority ethnic groups are represented significantly higher in mental health, the mental health organisation Mind point out there is no definitive interpretation of these. Despite this claim, there has been much debate. So why are black minority ethnic groups, in particular men, considered to be highly represented in mental health? Edward Davey, chair of Lambeth Council's Health and Adult Social Services Scrutiny Committee, highlights one of the key themes. While black people are massively overrepresented in the most serious end of the mental health system, they are consistently underrepresented in mild and moderate treatment areas. Most black young males enter the mental health system involuntary through the criminal justice system, not voluntary through user involvement. Edward Davies says that many black people fear formal mental health services as places they have seen too many friends, family or community members deprived of their liberty and even lives. And high-profile cases such as the deaths of Sean Rigg and Olaseni Lewis have weakened public confidence in the mental health services. This creates a vicious circle where black people stay away from services until they're so unwell that treatment is less likely to be successful and they're more likely to react negatively. Author Jerry True adds, they perceive that the way services respond to them mirrors some of the controlling and oppressive dimensions of other institutions in their lives. There is a perception that mental health services replicate the experiences of racism and discrimination of black people in wider society and in the past. Socio-economic pressures are also considered to be stressors. The greater the gap between the rich and the poor, the greater differences are observed in health. Black and minority ethnic people make up some of the most deprived communities in England. The Mental Health Foundation points out some of the disadvantages. Adverse mental health outcomes are 2 to 2.5 times higher among those experiencing greatest social disadvantage compared to those experiencing least disadvantage. The Equality Trust shows the relationship between income equality and the prevalence of mental health in different countries. The greater income inequality, the greater percentage of mental health illness. The Parliamentary Office of Science and Technology say that poorer socio-economic positions of black minority ethnic groups is the main factor driving ethnic health inequalities. Hints of institutional racism and service user experience could also be seen as contributory factors. Jerry True says that there is increasing evidence that points to differential quality of aftercare provision and follow-up for African Caribbean people compared to their white counterparts. African Caribbean people can be more likely to receive high peak doses of neuroleptic medication and also be given medication in the form of long-acting depot injections. It is suggested that this mostly arises from professional stereotyping of black patients as both being more dangerous and also less likely to show appropriate insight. Black people are more likely to be admitted under a compulsory order, particularly so for young men who may be up to 17 times more likely to be detained in this way. This has been shown to be the case where there is no significant difference in people's use of violence or threatening behaviour prior to admission. These user experiences could be deterring black males from mental health services, resulting in important treatment not being received, and in the long term, this could be keeping people in mental health services rather than out. Many analysts believe that white psychiatrists often have a poor understanding of the cultural background of minority ethnic patients, that they hold racially stereotyped view about behaviour in black people, and that their diagnostic methods are Eurocentric. Consequently, they could misdiagnose patients from other cultures.